Hello, everyone. Greetings for the day. I'm Saintha from All About Skin Wellbeing. I'm sure all of you must be doing really good. We all know taking good care of our skin is important for more than just the appearance. As the largest organ, our skin becomes the most essential to our overall health. A fungal infection is a very common condition on our skin or nails. Fungal infections are diseases caused by a fungus. Mild fungal infection can look like a rash and it can be really itchy and annoying. So let's connect today with our skin expert, Dr. Malar Nisha R, who is joining us live from Chennai to enlighten us on the topic of fungal infection. Dr. Malar Nisha is an accomplished and highly skilled dermatologist and cosmetologist with over 8 years of experience in providing expert skin and hair care solutions. She holds a fellowship in aesthetic medicine from the renowned Institute of Laser and Aesthetic Medicine. Today, she will share with us on fungal infection. A very warm welcome to you, Doctor. So, Dr. As today we are going to talk about fungal infection. First of all, we would like to understand what is fungal infection, how it is caused, and which are the body parts that are more prone to fungal infections.
Okay, so fungal infection, a kind of skin rashes, which occurs mainly due to fungal cells in our body. So this fungal cells can be of, due to many other fungal species like Candida, Trichosporum. There are so many superficial fungal infections. So with that, we get, once a person is getting infected with fungal infection, they get rashes, mainly like redness, then followed by itching. So the patient scratches so much.
So today we are talking about fungal infections. The topic is fungal infection. Dr. Malar Nisha is with us, though there is some technical or network issue which we are trying to fix so that we can go ahead with the conversation that we were having. So basically today we are going to talk about fungal infection, the superficial fungal infection, which mostly occurs on skin or nails or sometimes on our scalp. We'll try to find out what are the things that we need to take care of, how important is keeping personal hygiene because it is highly contagious, plus what to do if we get this infection, how to take care of us, what is the treatment protocol. Yeah.
Yeah.
So we were talking about fungal infection, how it is caused, and which are the body areas that are more prone to having fungal infections.
So, fungal infection is mainly caused because of fungus. Fungal infection is nothing but when a person gets infected to certain fungal species, so they produce fungal cells in the body and that leads to infection. So, there are certain symptoms by which we can find out if it is a fungal infection or not. So, the fungal infection can be it can show symptoms like mainly itching, redness. Then, because of that, you scratch a lot and it lead to so much of rashes. And then sometimes flakiness is also there. And these are the main symptoms for fungal infection. So the fungal infection occurs everywhere in the body almost, mainly over the fold area, like on your underarm, maybe in between your thighs. So where the sweat accumulates more, the fungal cells grows more. So you can see the fungal infection, the fungal symptoms and signs mainly over these areas. So once a person is getting more sweating, so they tend to have fungus growth on that area, and
Okay.
with that you can find the redness, and because of that redness, you'll have more scratching, itching, and flakiness also.
Okay, fair enough, doctor. Now, doctor, we would also like to understand what is the preventive measures. What are the things that we need to keep in mind to prevent ourselves from having fungal infection?
So the preventive measures include mainly only thing is like it is a one-to-one contact. The fungus is like a spreading disease. When one person infected is coming near you, you may also get infected. So the main thing to avoid and prevent fungal infection is like we have to avoid sharing the clothes or towels or whatever your personal belongings to another person. Even if it is a family member, it's better to have a separate your own personal belongings, and not to wash your clothes with the infected person. And mainly during this hot and humid climate, you will be over sweating. So it's better to take bath twice daily. And once you are, like you are wearing a sweaty t-shirt or anything, it's better you change off the clothes after you come from your work or even from your gym or any other kind of physical activities. And you should keep your skin dry and clean. That should be the main component which you can do to avoid your infection with fungus.
Care of us is very important. Doctor, one thing, what happens when a person gets fungal infection? Most of us don't understand that whether it's fungal infection or any other kind of infection. Rather than going to the doctor or going to the dermat, we normally tend to experiment a lot. We'll, go for over the counter medication, any ointment, application of that, or home remedies, DIYs. So, what is your take on that?
um, um, it is always better to consult with a dermatologist. See, you can go to a normal physician also, where they will refer you to a dermatologist. It's actually better not to take any self medication, because there are so many self medication available with not only antifungal, with all antibacterial, steroid, and all together combined creams. So when you start applying these creams, when you get these products from any pharmacy and you start to apply this cream, so it may just overlap the fungal growth, and it will be always your skin will be having that fungal infection. So you will be like seeing like, what if you are applying a cream and that is not resolving? So finally you end up going to a dermatologist. So better you can have your first clinical visit with a dermatologist rather than going to any, getting an over the counter medicine or going to a pharmacy and shopping any antifungal creams, whatever they give. And only a dermatologist can find out what type of infection it is, and you need any topical only cream, or maybe you need a systemic cream also. It's better to find out from a dermatologist. So I will advise you to go to a dermatologist rather than getting your own self medication. Maybe a preventive measure you can do.
Right. Because many a times we have seen people going for, home remedies or DIYs, over the counter topical application, or many a times people who have gone, their friends or relatives who might have gone to a dermat, they also pass on their prescriptions. So nothing works. You need to go and consult the doctor all by yourself. Now, doctor, when a person comes to you with fungal infection, are there any tests that you normally recommend, or just by clinical or physical investigation, you're sure that this is fungal infection and it will need this much long duration of treatment?
Okay. So, when a fungal infection, usually like you can see it on your skin, maybe it will affect your hair and nail also. So, if it is a condition, a person is coming with a kind of infection on the hair, it's better to do a scalp follicle test so that you can find out if it is a fungus or not. You just scrape that area, and it can be done through some kind of investigations by a dermatologist. Or if it is any nail also, there are separate investigations available just to rule out if it is a fungal infection or not. And yes, of course, for the skin also, there are a variety of tests available just to find out like a microbiological test, just to find out like a microbiological test, just to find out if it is like a fungal infection, or if just a fungus is present on the body or not. But it's not that necessary, because fungal infection will be presenting in a skin, as I told you, maybe as a round patch with it will be looking like a map border. So maybe on the border area, you can just find out if it is. As a dermatologist, no, I can just find out if it is a fungal infection or not. But yeah, there are certain investigations available. Coming to diabetes patients who are more prone to get fungal infection, it's better to check their diabetes level also before giving any kind of treatment.
Right. And those who have already applied those, unprescribed topical application, which may contain steroids for a longer duration. I'm sure you also get patients who has come after, months of applying those topical application. Does it become difficult to diagnose their infections?
Yes, of course. Like I told you before, like people get the medications from over the counter or from the pharmacy, or someone their friends or someone recommend them to use the cream. So that will actually overshade the typical fungal infection seen. So it is so that they will not be known if it is a fungal infection, or they might think it is because of some other insect bite reaction or any kind of allergy in the body. But once they come here, meet us like a dermatology doctor, so they will be better to rule out and find out and just explain them not to apply these kind of medications. And apart from that, there are systemic fungal infections also available. So, I mean, systemic fungal infections are nothing but which just not only it is seen on your skin, hair, and nail, it's just seen on your internal organs also. So, for that also, there are separate treatments available.
I was asking, what are the treatment options available?
So the treatment options available for fungal infection will be, see, according to the type of infection and the spread of the disease, there are different treatment options available. Maybe if it is only a very small area affected, maybe we can go for a topical cream alone. If it is affecting a large or a vast area, you have to take, and you have the disease for a long time, it's better to go with an oral antifungal and topical antifungal also. So, yes, there are oral antifungals treatment available. Apart from topical antifungal, maybe like a cream, soap, shampoo, body wash, so many are there.
Right. So a lot of treatment options are there. But then, doctor, if in a family, a person is affected by fungal infection because it is contagious and others are also at risk, what precaution the other family members can take?
Okay, so precautions, better to stay away from the person who's infected already, because it can spread by touching or contacting them or sharing any of the personal belongings like a towel or a clothes, or maybe you are using a washing machine to wash all the clothes together with an infected person. There are chances of the disease spreading to the another person in the who's staying with them. Okay, and as and if it is like you go to any workplace or any other place, it's better you avoid using public toilets, um, or you have to go for any prevention measures to avoid um contact with the public toilets, like by you can have your own kind of be safe or any other materials with you, and it's always better to walk with shoes or any kind of sandals or slippers into the toilet, or even in the common public areas. It's always better to avoid walking in barefoot. So these can be done. And apart from this, when you are exposed to so much of sweating, dust, it's better to take bath twice a day. So that would be
Right.
recommended to prevent a fungal infection.
Right. So prevention is the key. Still, in case you get fungal infection, please go to a board certified, a qualified dermatologist. They'll help you get rid of it. And it's very important. Doctor, we have also seen a lot of cases of recurrence of fungal infection. What is the most common reason of recurrence?
So recurrence will be mainly because one person is having a weak immune system. they will have a recurrence. So weak immune system means the person will be affected with any kind of immunodeficiency disorders, like they may be affected with any cancer, or and they are under any kind of chemotherapy or any treatments, or they are affected with HIV or any other kind of infections. All these people will have a weak immune system. Or if anyone going for an organ transplantation like a liver or a kidney transplant people, they also will have a weak immune system. So all these people will be tend to get, I mean, like will be tend to have this kind of fungal infection. So they will be getting repeatedly again and again as a recurrence. So it's better for them to avoid all these kind of whatever I said, like they have to go for this preventive measures to avoid the fungal infection. The second one, it could be in case of pregnancy also, like because pregnant women, like they are more prone to get these kind of fungal infections. Because during pregnancy, there are certain skin changes which comes in a woman. So sometimes they will be having more amount of sweating on due to their obese or overweight. They will have this kind of fungal growth attacking their body. So it's better for them also to keep safe from any kind of fungal infections from outside. The third one, it could be because of drug resistance. Because people know they tend to use, if we give a if one person is coming to our clinic who is affected with fungal infection, so we give the cream for them for a period of time, but they tend to use that cream repeatedly again and again for a long time, maybe up to a year also. So that time, the drug will become more resistant. Even the tablets they are taking now. So the people, it's see, once you get an infection, you come to a doctor, they give a cream. So again and again, when you are getting, you just start to use the same cream. So that shouldn't be done because the drug will become more resistant. So they are tend to get fungal infection again and again. So it's better once infected, you come to a doctor, but second time also, if it is infected, it's better you come to a dermatologist again.
Okay. So, doctor, what happens many times people don't follow the prescription fully. For example, you have given me a prescription of 2 months. I'll follow it religiously for, say, 15 days, 20 days, but then I'll get, lethargic. And what happens? We don't even inform our doctor, but we'll stop taking the medication. And what is your stand on that? Is it a good to do practice or we need to complete the prescription?
See, if we are giving a treatment for a period of 1 month, there are people, I mean, like when you start applying this topical antifungal creams, resolvation in maybe 2 weeks or 1 week. So the people tend to stop applying the creams and stop taking the medicines. But only thing is, maybe on the superior, superficial area, it will not be seen. There will be still growth present, fungal growth present in your body, which may be recurring later, maybe after if you, 1 month or something. So you have to come back again. So if we are giving a period of time, maybe for 2 weeks or 1 month, a course of tablets or cream, it's always better. You have to use it on a daily basis, and you have to complete the tablet schedule also.
Right. So completing the prescription is very important.
So, yes.
Okay. And doctor, one more thing, we have mostly talked about skin related fungal issues, but we see a lot of fungal issue on nails and scalp as well. So first of all, we would like to talk about the nail fungal infection. Who are more prone or at risk of having nail fungal infection? How much time the treatment takes, etc.
Okay, so the nail fungal infection more prone is more mostly to females because they tend to do all kind of household works, no, like so they don't find. I mean, they just don't notice also. So when the nail color is changing, so usually when a nail is getting
Hmm.
infected, it will be mostly an yellowish. It will start to form like an yellowish to blackish pigmentation color changes will be there. So it will start invading only from the sides. There is a small area on your nail side called as cuticle. And so when you try to remove that while you cut your nail, some people know they cut that part also. So when they try to remove that, um, there are chances for the fungal to invade, and thus they form a nail infection, fungal infection. So this nail fungal infection, it has to be, as far as I have seen, it's like more common in people who are nail biting and who doesn't cut their nail properly, and people who are more prone to use this kind of vegetable cutting, and they do all other household activities, like washing and vessel washing, clothes washing. All these kind of people also are more prone to get fungal infection. So it's better while doing any household activities. It's actually better to use any kind of kitchen gloves or any household gloves. People who are working as a any kind of maid or servant, helper at home, it's always better for them to use a glove or anything. Like we have a helper at home, it's better we also give a glove to them so that it doesn't get infected for them, and from them also it shouldn't come for us. So all these kind of preventive measures can be done. And for nail
Right.
infection,
So,
it's
yes, yes, please continue, doctor.
and for nail infection, it's actually there are treatments available, but it will take a little longer than a skin infection for the resolution.
Yes, yes, doctor. Doctor, also talking about the scalp fungal infection, does it look very much like
Not
dandruff
only as
only?
a
As a
layman, I
layman, I
mean,
mean,
many
many a
times,
times,
we
we
also
also tend to treat the dandruff with more of oil on the scalp. So, would you like to throw some light over the scalp fungal infection?
So the fungal infection affecting the scalp, it could be mainly a big. See, dandruff is also a kind of fungus only, which grows everywhere on. I mean, like almost on the scalp. So it is a type of fungus. We call it as Malassezia yeast. So this usually develops in almost every person who are more prone to, I mean, like prone to exposed to all these kind of dust and environmental pollution. So they tend to have, and even with the water, the saltness, the hardness available, so they are also more prone to have this kind of fungus growth on their scalp, and we call it as a common term as dandruff. So for the dandruff, there are separate anti-dandruff shampoos available. And since the fungus grows more on the oily areas, we ask them not to use fungal, I mean, oil application. Maybe if you want to apply oil, maybe you can just keep it on your scalp maybe for half an hour or something, but not more than that.
yes.
Yeah. So there
Doctor, we
are
are
other
also getting
fungal
a lot of
infections also
questions
available.
by our
Yeah,
viewers.
you can
So
ask
I'll
them.
also like to, because one question is, pointing towards that area, which is the fungal infection of groin area. Many times people are so
Okay.
hesitant, they don't want what to talk about it. How important it is to go and consult a proper, doctor, dermat, in case we have fungal infection in the groin area.
So groin area, usually men and women both are equally. They We can see these kind of fungal infection both in men and women. So only thing is to avoid the fungal infection coming on the groin. It's like wear some loose pants or loose cotton pants. Not wearing a jean, mainly during the summer. Okay, so these when you wear a jean or any kind of tight leggings or anything, there will not be a breathing space. Okay, so that you tend to have more sweating in this humid weather, and your sweat accumulates there, and because of that, the fungus grows, and thus you get a fungal infection on the groin area. So. As a preventive measure, it's better to avoid wearing the kind of jean or so some people whatever clothes they wear it repeatedly 2 to 3 times. After that, they wash. So don't do like that. It's better you use one cloth a day, Maybe if you are wearing any pants or any kind of dresses, you wear it for that day. Maybe you can wash it and wear it on the next day. But don't just accumulate and wear it again and again, because that also will lead to fungal infection. And for groin area, there are separate creams and yeah, of course, soaps and tablets available. But even though it's better you consult with your dermatologist and then start applying any kind of creams, because that area is a very sensitive area. So if you are getting from any OTC counter products and you apply, and it shouldn't harm your skin.
Please do not experiment with your skin, your scalp, your nail in case you have fungal infection. Go to the correct person. Even if you don't know whether it's fungal infection, any other thing, allergy, whatever, go to the correct person, which is a qualified dermatologist. Doctor, most part of India, or some part of India, I would say, have already started receiving the pre monsoon, showers. And soon we are going to enter that phase of monsoon. And monsoon is a time where, more it's so much of humidity. We all sweat a lot. Plus, our clothes doesn't dry properly because sun is not there. In that case, especially for our undergarments, what do you suggest? Because we are so compelled to stay with those almost wet, damp, or sweaty undergarments or clothes which are touching our body parts again and again, increasing the risk of fungal infection. What's your take or advice on that?
So, I mentioned you before itself, like the skin should be dry and clean. So, if you are wearing any damp clothes, it's anyway, it's going to make your skin also wet. And it is tough mainly over where you stay, and it's very hard for the uh, um, drying the clothes. But yes, you shouldn't wear any kind of damp or wet clothes. I would not suggest to wear damp or wet clothes. If it is damp or wet, please don't use it. And undergarments, mainly you can go for any kind of cotton friendly or any skin friendly, not pure cotton, maybe cotton mixing. Don't go for any kind of satin or any other kind of undergarments. So this cotton friendly will reduce the sweating also, and moreover, your skin friendly also it will be. So better you choose any undergarments or anything. Just try to avoid wearing this kind of wet pants or anything. Maybe you can go for reusable, or maybe use and throw undergarments. Maybe if you are going to any kind of common public areas and you want to go for any kind of you are doing any kind of activity, you are more exposed to outside environment. So better you make you can use and throw kind of undergarments also. I would suggest that.
Garments so that we can use one fresh even if the others are not properly dry. We can iron them properly. That's also one option which can dry them completely. Or using use and throw disposals, underwear, undergarments can also work. Now, doctor, viewer is asking, and it is such a common question people often ask: can fungal infection go away on its own?
No, not at all. It will not go away on its own. It's only you have to get it treated. Maybe you can avoid coming back so that the recurrence can be avoided, but it doesn't go away by its own. There is no,
Okay.
not even a single chance.
Right. And another very common question people often ask: can I swim or can I go to gym in case I have fungal infection?
See, you can go to gym, but swimming I will not suggest. But better, see, if you have a fungal infection, better you stay away so that other person also doesn't get infected.
Hmm.
So swimming, maybe if it is resolving, you can go. Otherwise, please don't go to swimming and all. Maybe gym activity you are going, better you just take bath with the cream and soaps, whatever the doctor has given. Just follow that after you go from the gym. When you go to your house, no, from the gym, it's better you follow that use a soap, just wash your, I mean, take a bath, wash your clothes, then apply the cream. Just follow that. That also will be preventing fungal infection, and it will resolve your fungal infection also. But don't share towel or anything
Right.
with
And Doctor, we have also,
the
you have
gym
also
people,
mentioned
I mean,
that.
like your colleague or anyone.
Right. We have also seen a lot of case of ringworms or fungal infection in the toe or in that area. And as you also mentioned, it's quite common, and especially again during monsoons, with humidity, and even now with summer, it's so much of humidity. But in an office environment, in a formal environment, we are bound to wear socks and shoes for long, long hours, and that keeps adding up to our problem. So, what we can do, what preventive measure we can add to that?
Preventive measures, I already told you, it's better you just keep yourself clean and have your own kind of, I mean, separate clothes and separate towels, separate soaps, body wash, everything you keep it safe and separate, and don't mix and wash it with any other people's clothes. So that is the main preventive measure you can do. Okay, and once and try to wear more cottonized clothes in a hot and humid weather. Avoid wearing the damp clothes. And once you see any kind of rashes or allergy on your body, please go consult with a dermatologist. Don't apply any OTC medicines, and don't make it worse. So that will be, and if someone in your family is also having any kind of rashes, please ask them also to go to any dermatologist, or you just take them and get a consultation with a dermatologist so that it doesn't spread for you again.
Now, Doctor, I was talking
So
about
main preventive measures can be this.
the fungal infection in our toe area, because we are many a times bound to wear shoes, toes, or, inside the toes, that
Mm.
area. We are bound to wear formal shoes with socks for hours in our office, etc. And that keeps adding to our problem. So, what we can do before, putting on our socks, can we use antifungal, say, powder or anything on that?
See, certain people will have more sweating on their soles, okay, when they wear a shoe, socks, and all. So, two tips I can give you. So, one tip can be you can wear, there is antifungal powders available. You can just use the powder and then apply the powder and then wear your socks and shoes. The second one is just wash your socks daily on a daily basis. Better you wash your socks. Okay, that is the second tip I can give you.
And doctor, before we wind up the whole session, any take home message for our viewers?
So the take home message is like, please be careful when you find any kind of skin rashes or anything on your body. Please visit a dermatologist and get your consultation. Don't take any kind of OTC products and don't apply it and harm your skin. Then you come to the doctor. It's actually very hard for you and even for the doctor also. So it's better you consult with the dermatologist as far as possible. And whatever signs and symptoms I told you for fungal infection, please make it clear and in the nearby dermatologist as soon as possible.
And working on one's immunity, how important is that to deal with fungal infection, doctor?
Okay, so I told you, no, like people have a weakened immune system, like I told you, diabetes patient, any kind of thyroid or any kind of organ transplantation or any surgery associated patient, they will have more prone to get fungal infection. So it's always you for anyone, not telling only about the kind of affected people, even for a normal, common 18-year or 19-year boy or a small kid also, they should have a good immune system to prevent this attack of any virus, fungus, or bacteria. So it's better you you keep your body hydrated, you clean your body, And mainly you can take lot of supplements, like mainly you can have during this hot climate, it's better you have some kind of cucumber or any kind of curd, or any kind of cooling vegetables, like you see pumpkin and all, no, they have so much of water content in the body. So when you, as far as I mean, like you can have yourself hydrated, please keep yourself hydrated also to prevent these kind of infections, and take bath twice daily. That should be done.
Right. Thank you so very much, Doctor. It was a very informative session. Thank you for taking out the time for this. Thank you so very much.
Yeah. Thank you. Thank you.
And viewers, thank you for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page all about skin well-being. We're also available on YouTube, Twitter, and Instagram. Thank you and have a great evening ahead.